I'm going to talk about tuberculosis. Tuberculosis, also called TB, is a serious illness that mainly affects the lung. The germs that cause tuberculosis are a type of bacteria. Tuberculosis can spread when a person with the illness coughs, sneezes, or sings. This can put tiny droplets with the germ into the air. Another person that breathes in the droplet and the germ enter the lung. Tuberculosis spreads easily where people gather in crowded areas. People with HIV or AIDS and other people with weakness immune system have a higher risk of catching tuberculosis than people with typical immune system. Antibody medicine can treat tuberculosis, but some form of the bacteria no longer respond well to treatment. When TB germs soar and multiply in the lung, it's called a TB infection. There are three stages. First, primary TB infection. The first stage is called the primary infection. Immune system cells find and capture the germ. The immune system may completely destroy the germ, but some captured germs may also survive and multiply. Most people don't have symptoms during a primary infection. Some people may get flu-like symptoms such as low fever, tiredness, cough. Late-in TB infection. Primary infection is usually followed by the state of late-in TB infection. Immune system cells build a wall around lung tissue with TB germ. The germ can't do any more harm if the immune system keeps them under control, but the germ survive. There are no symptoms during late-in TB infection. Third, active TB disease. Active TB disease happens when the immune system causes disease throughout the lung or other part of the body. Active TB disease may be happen life after primary infection, but it usually happens after month or year after late-in TB infection. Some of active TB disease in the lung usually being gradually and worsen over a few weeks. They may include cough, coughing out bursts of mucus, chest pain, pain when breathing or coughing, fever, chill, night sweat, weight loss, not wanting to eat, tiredness, or not feeling well in general. TB disease outside the lung. TB infection can spread from the lung to other parts of the body. This is called extrapulmonary tuberculosis. Symptoms vary depending on what part of the body is infected. Common symptoms may include fever, chill, night sweat, weight loss, not wanting to eat, tiredness, not feeling well in general, pain near the site of the infection. Cause tuberculosis is also caused by a bacterium called Mycobacterium tuberculosis. People with active TB disease in the lung or white spot can spread the disease. They release tiny droplets that carry the bacteria through the air. This can happen when they are speaking, singing, laughing, coughing, or sneezing. A person can get an infection after inhaling the droplet. The disease is more likely to spread when people spend a lot of time together in indoor space. So the disease spread easily in places where people live or work together for long periods. Also, the disease spread more easily in crowded gatherings area. A person with latent TB infection cannot pass the disease to other people. A person taking medicine to treat active TB disease usually can't pass the disease after 2 to 3 weeks of treatment. Drug-resistant TB. Some form of the TB bacteria have become drug-resistant. This means that medicine that once cured the disease no longer works. This happens in part because of the naturally occurring genetic change in bacteria. A random genetic change in a bacteria might give it some quality that makes it more likely to survive the attack of an antibiotics. If it does survive, then it can multiply. Diagnosis. To diagnose a tuberculosis TB infection, your healthcare provider will do an exam that includes first, listening to your breath with a stethoscope. Second, checking for a swollen lymph node. Third, asking you questions about your symptoms. TB test. Your healthcare provider will order tests if tuberculosis is suspected. You are likely exposed to be a person with active TB disease. You have health risk for active TB disease. Skin test. A tiny amount of a substance called tuberculin is injected just below the skin on the side of one forearm. Within 48 to 72 hours, a healthcare provider will check your arm for swelling at the injection site. The size of the red skin is used to determine a negative or positive test. This test is seeing if your immune system reacts or has made an antibody to tuberculosis. A positive test indicates you likely have either latent TB infection or active TB disease. People who had a TB vaccination might get a positive test even if they have no infection. A negative test means that your body doesn't react to the test. It doesn't necessarily mean you don't have an infection. Blood test. A sample of blood is sent to a lab. One lab test finds out whether certain immune system called recognize tuberculosis. A positive test shows that you either have a latent TB infection or active TB disease. Other tests of the blood sample can help determine if you have active disease. A negative result means you likely do not have a TB infection. X-ray. A chest X-ray can show irregular patches in the lung that are typical of active TB disease. Other lab tests may include breath tests, procedure to remove sputum from your lung with a special tube, urine test of the fluid around the spine and brain, called cerebrospinal fluid,